Welcome to This Explainer. Today, we're diving into a topic that affects a surprisingly large number of men, but one that almost nobody talks about openly: Peyronie's disease. Whether you're a medical student, a healthcare professional, or just someone looking for clear, factual answers, our goal today is to completely demystify this condition. We are going to strip away all the stigma and look purely at the biological mechanics of what exactly happens when a previously straight penis begins to bend progressively over time.
Okay, let's dive into this. Here's our structured roadmap for today. 1. Mechanics of the curve. 2. Causes and risk factors. 3. Active versus stable phases. 4. Diagnosis and symptoms. 5. Debunking common myths. And 6. The psychological toll.
All right, starting right off with Section 1, Mechanics of the Curve. Now, to really wrap our heads around this condition, we first have to understand the extraordinary mechanical engineering of the human penis, specifically a tough, fibrous inner layer called the tunica albuginea. Normally, you can think of this layer like a remarkably strong yet flexible balloon that stretches evenly when filled with blood. But in Peyronie's disease, that normal tissue structure changes. The absolute hallmark of this condition is the formation of a plaque. And I want to be super clear here, even though they share the exact same name, this is entirely different from the cholesterol plaque that clogs up your blood vessels in heart disease. A Peyronie's plaque is actually a dense, localized buildup of collagen and fibrous scar tissue that sits right inside that tunica albuginea. And this brilliantly illustrates what's actually going on mechanically. Healthy connective tissue has this perfect balance of strength and elasticity, right? It stretches out evenly. But a Peyronie's plaque is basically rigid, inelastic scar tissue. Imagine taking a balloon and slapping a thick piece of duct tape right on one side of it. When you try to inflate it, all the healthy rubber stretches out, but the tape side just can't budge. The result? A mechanical force that literally forces the whole thing to bend toward the rigid, taped side.
Moving on to Section 2, Causes and risk factors.
So now that we know what's mechanically causing the bend, what actually triggers this biological failure in the first place? Well, the leading scientific theory traces this all back to a wildly dysregulated wound healing process. It usually starts with something completely microscopic, tiny little tears in the tunica albuginea that happen during regular intercourse. For the vast majority of men, these micro-injuries heal up perfectly normally, no problem. But in susceptible guys, the body's repair system totally overreacts. Massive inflammation sets in, which releases chemical signals, primarily one called transforming growth factor beta, or TGF-beta. This chemical commands local cells called fibroblasts to basically turn into hyperactive scar tissue factories. They pump out excessive amounts of collagen, which eventually clumps up, contracts, and pulls the tissue into that physical deformity.
You might be wondering, who's actually most susceptible to this exaggerated healing response? The data points us to a few key systemic risk factors. Age is a major one, for sure, with most cases appearing in men between 50 and 70, simply because tissues naturally lose elasticity over time. Diabetes and smoking are big ones too, because they impair your blood vessels and oxygen flow, which completely messes with normal healing. But honestly, the most fascinating link is to something called Dupuytren's contracture. This is a genetic condition that causes thick, fibrous tissue to build up in the palm of the hand. This genetic link is absolutely crucial because it shows us that Peyronie's isn't just some isolated penile issue. It's often a sign of a systemic, full-body tendency toward excessive scar formation.
Next up, Section 3, Active versus Stable Phases. Now, what's really interesting about this condition is that it's not just a single, static event. It actively evolves. Understanding this timeline is absolutely critical because it dictates exactly how doctors treat it. The disease basically has a binary timeline. First, you have the active phase, which lasts anywhere from 6 to 18 months. During this window, the plaque is actively forming, inflammation is super high, patients often experience noticeable pain during erections, and the curvature progressively gets worse. Because the internal landscape is constantly shifting around, surgeons will generally refuse to operate here. They wait it out for the stable phase. Once you hit the stable phase, the inflammation finally burns out, the pain usually completely disappears, and the curve stops getting worse. But, and this is a big but, the physical deformity, the scar itself, remains there permanently unless it's specifically treated.
Okay, Section 4, Diagnosis and Symptoms. So what does this actually look and feel like for a patient? The symptoms really go far beyond just a simple bend. First off, the direction of the curvature is entirely dictated by exactly where that plaque forms. It can pull up, down or off to the sides. Plus, because that dense scar tissue actively contracts and tightens up, patients very often experience noticeable penile shortening on the affected side. In really severe cases, the shaft can actually develop a deep indentation or a crazy hourglass narrowing, which makes the whole structure mechanically unstable. And, complexly linked to both the physical scarring and the massive psychological stress of the situation, erectile dysfunction is an incredibly frequent companion to this disease. Navigating the diagnostic journey can definitely feel a bit daunting for guys, but it is an incredibly standardized professional clinical process. It always starts with a detailed medical history just to map out the timeline and rule out any other potential issues. Next is a physical exam, where the doctor can usually just feel the firm, palpable plaques right under the skin. Often, physicians will induce an erection right there in the clinic using medication, or sometimes they just rely on patient photographs to accurately measure the exact angle of the curve. And finally, a high-resolution penile ultrasound, particularly a Doppler ultrasound, is an invaluable tool. It lets the doctor literally see the plaque's exact size, check to see if it's calcified like bone, and thoroughly evaluate the underlying blood flow. All right, let's get into Section 5, Debunking Common Myths. Because we're talking about sexual health here, this condition is unfortunately surrounded by a massive amount of misinformation, embarrassment, and totally unwarranted fear. So let's clear the air with some strict medical facts. We're going to start with the absolute most frightening question that a lot of men secretly harbor when they first notice a change down there. Is this some form of cancer, or is it a sexually transmitted disease that I'm going to pass on to someone else? Let me give you a definitive, scientifically backed no. This is completely false. A Peyronie's plaque is entirely benign scar tissue. It will literally never transform into cancer. It is absolutely not contagious, and there is zero way you can transmit it to a partner. It is strictly a localized tissue healing disorder. Here's another one we hear all the time, and it causes a huge amount of unnecessary shame for patients. Many guys incorrectly jump to the conclusion that their own private habits are somehow to blame, asking, does ordinary masturbation cause this disease? So the crucial point here is that there is absolutely zero scientific evidence supporting that idea. While we did discuss that vigorous mechanical trauma during intercourse, like abruptly slipping and striking a partner's pelvis, can trigger those micro tears in susceptible men, normal masturbation does not create this disease. It is frankly not considered a cause. And what about the endless barrage of so-called quick fixes you see popping up all over social media and internet forums? Can unregulated at-home stretching exercises permanently straighten things out? Again, that is a hard no. Our sources are incredibly clear on this. Unregulated techniques completely lack scientific backing. In fact, excessive, aggressive manual manipulation without real clinical guidance can actually cause even more tissue injury, which can potentially make the scar formation so much worse. Any kind of traction or stretching therapy absolutely must be done under strict medical supervision using properly evaluated clinical devices. Let's move to our final area, Section 6, the psychological toll. Let's step back and see how this physical issue builds into something that impacts a person's entire life. This quote from our source material perfectly captures the hidden reality of the disease. It says, "The greatest psychological burden of Peyronie's disease arises not from the physical deformity itself, but from its emotional consequences." For so many guys, the mental anguish of this condition far, far eclipses the actual mechanical difficulty. The emotional fallout here is incredibly profound and heavily documented by researchers. We're talking about severe spikes in anxiety, clinical depression, and a massive hit to self-esteem. What's truly tragic is that many men become so distressed and embarrassed by the physical changes in their body that they completely withdraw from romantic relationships and actively avoid sexual intimacy altogether. And this happens even in cases where they still maintain perfectly adequate physical erectile function. It just goes to show that effectively treating Peyronie's means you have to treat the whole patient, not just the physical curve. But hey, it is not all doom and gloom. There is actually incredibly good news here. We are no longer living in the dark ages when it comes to this condition. Modern medicine offers a seriously robust arsenal of effective options. Over the past 20 years, we've seen massive leaps forward. Highly advanced imaging, proven clinical traction therapy, specialized injectable medications that actually go in and chemically break down the plaque, and amazingly sophisticated reconstructive surgeries. The biggest takeaway here? Patients absolutely do not have to suffer in silence. Real, highly effective help is available right now.
There is, however, one very heavily advertised treatment that we still need to talk about. Men's clinics all over the world are currently aggressively pushing low-intensity extracorporeal shockwave therapy as some kind of miracle cure. But where does it actually fit into real clinical guidelines? Does the hardcore science actually back up all this flashy marketing? And most importantly, can shockwaves actually straighten out a curved penis? Well,